Some of the questions regarding footwear. How long to wear the new footwear that is brought for a running activity or a sporting activity? On an average, 6 months is the time, or if it is the patient is a runner, the person is a runner, on an average about 300 to 500 miles. After that, you may have to change your footwear. And moreover, the indication itself is that you start developing pain or you feel very uncomfortable. That's the time to look for the sole and the inner side of the shoe, the wear and tear, and then you have to change. So thumb rule is about 6 months. The second question is, does using shoes for children have any benefits or harm? To be frank, wearing shoes for children, there is no harm. At the same time, there is no added benefit also. But in case of children with flat foot with a deformity, we advise parents to start putting them into the shoes at the early age, so that at least the deformity can be avoided and the normal alignment can be maintained, so that the normal development and the growth of the bones can be achieved. But if it is the custom and the habit of the family to use the shoes, very well, and if it is not, that is also acceptable. There is no hard and fast rule that children have to be put in shoes, or the shoes are going to harm the kids. The other question that people get doubts regarding the shoes is the barefoot running or running with the shoes. If you are into the barefoot running, very well, you can practice that, and once with the practice you start slowly under the guidance of a coach. But if it is not, don't suddenly one day get up and read some article and start running barefoot, because a person who is not used to run barefoot or walk barefoot, if you suddenly do on a very exerting or a very strenuous activity, you may even end up having fractures, having injuries to your muscles and the ligaments and the tendons. So it can be done gradually, but it takes a longer time to get adapted to barefoot running and barefoot strenuous for sporting activity. But if you ask me, is there any added advantage? It is difficult to say. Other question that people ask about is walking barefoot in river sand or sea sand is beneficial. Of course, definitely it is beneficial for a person who does not have any other medical issues within the knee or the hips and the ankles. And the reason is, when you walk barefoot on a sand in the beach or a river bank, you exert more energy, use more muscles for the grip and the more the proprioception, or we say the balancing muscles, will come into action. So thereby you are strengthening your foot and leg muscles, and also you are spending more energy. So thereby your exercising activity is more beneficial. But if you have any of these problems with your arthritis of the knee or the hip or the ankle, or recently got operated, avoid such walking, because that is more harmful than beneficial. And other thing that we get to use is there any relationship between footwear and the foot pain? And definitely, if not regarding the sport wear, but even the routine wear itself, like once you either shoes or formal shoes or the regular footwear, definitely is going to have impact on the shape or the weight distribution within the foot. So that is why a well maintained footwear and well aligned footwear is very, very important. So you always, once in 6 months or 8 months, you look at your footwear, and if it is wearing out, uneven wearing out is the first one, that if you notice that, it's the time to change the footwear or change the sole, so that there won't be an uneven distribution of the forces across the joint and the foot, but you will have a biomechanical advantageous equal distribution and anatomical distribution of the weight through your foot and ankle, so that you will have a pain-free normal gait pattern, and you will have a energy efficient gait. Thank you.